Hi, I'm Dr. Steve Hook, Culver City dentist. If we play a word association game and I said stop, would you say go? If I said chocolate, would you say vanilla? What if I said tooth decay? Would you say sugar, candy, dentist? I don't think you'd say nursing bottle decay, but that's a well-known problem, hopefully among experienced young parents. Nursing bottle decay is not well understood by many people, but it's a very bad but preventable disease. And it's basically caused by having young infants who have teeth, that is, children who are more than about 6 months old, who are put to bed with formula or juice that lays in their mouth over a whole period of time, like overnight. Within months, their mouths are ravaged by tooth decay. It's a simple and preventable problem. Simply give the child a pacifier or water at night, and we can avoid the problem. Simple enough, but a lot of people don't know it. Now, you may not be aware, but many of you have a new dental insurance coverage in your Basic Affordable Care Act medical policy that you were mandated to get under the Obamacare program. And that covers basic dental care. You can bring your child or your grandparent in as a grandchild into the dental office for an exam, and it doesn't cost anything at all. And we can detect a problem before it comes in and becomes a problem for that child. We can help motivate, we can show you how to take care of the child's teeth, and basically prevent a terrible problem before it begins. Now, one other thing, in case you don't worry about a child, they're beyond that, what about as an adult? The same problem that helps with tooth decay as a child happens to affect us as adults. Now, we should not really eat all that sort of bad thing, but let's face it, we're all busy. We snack, we nibble, we eat between meals. We don't perhaps eat like we should. You know, if you restrict your nibbling and your in-between meal eating to like nuts and raw fruit and so forth, you're safe. But let's face it, fast food, chips, convenience food, barcode food as I like to call it, is the scourge of our problems. Our decay rate goes sky high, not so much on the quantity of the food, but the number of times a day where teeth are exposed to it. So if you have sugared gum you chew, breath mints, you drink a number of sugared soft drinks a day, you have a big risk for a lot of decay. I'd like you to consider cutting that down, trying to keep the number of exposures a day down, substitute raw, unrefined types of food, real food as your snack. Come in, let us take a look at your teeth, see if we can catch problems before they begin. If you have any kind of dental coverage at all, it's usually no expense. If you have a child or a grandchild that hasn't been seen, again, that's covered under the Affordable Care Act health policies. Let us be your partner. If I was to say chocolate and you were to say vanilla, if I was to say basically stop and you were to say go, when I say tooth decay, it doesn't have to be pain or concern. You could be something else. We can prevent this problem with your help. I'm Dr. Steve Hook, Culver City Dentist. I can be found on the web at culvercitydentistdds.com. Thanks for listening.